Playlist. Hi, I'm Laura.
Hello, this is Surya.
Hi, I'm Roseanne.
Hi, I'm Monica.
Hello everybody, my name is Dustin Patterson and I'd like to thank you all for being here today. What I'd like to talk to you about today is the reasons why you should use fluoride in your dental products. So I want everybody to ask themselves a question. Do you want a healthy mouth, teeth that are strong, white, and free from decay? I believe that if we were all to answer this question, the answer would be yes. The knowledge that I've gained as a student in the Hillsborough Community College Dental Hygiene Program, along with additional research, have led me to believe that this is only possible with the use of fluoride. Fluoride helps make your teeth stronger and more resistant to decay by increasing the mineralization in the enamel. Fluoride can be taken into the body systemically through drinking water that contains fluoride or applied topically by the use of fluoride toothpaste, rinses, and professionally applied varnishes. Let's start by talking about what tooth decay is and about people who are working to undo successful measures in preventing it. Tooth decay or cavities are the most common chronic disease in children and adults. According to Awan, Darwich, Al-Hayek, and Dumet, research shows that tooth decay affects most people in the industrialized world and developing countries. Cavities occur because plaque bacteria that builds up upon the teeth take the sugars that we eat and drink, digest it, and turns it into destructive acid. If the plaque is allowed to go undisturbed and the enamel is not strong, the acid will decay the tooth, forming a cavity. In recent years, people have begun to protest the use of fluoride in drinking water and oral care products. These people spread misinformation as fact that could lead to a higher number of people getting cavities. In an article written by Jason Armfield, he says, water fluoridation opponents employ multiple techniques to try to undermine the scientifically established effectiveness of water fluoridation. The materials they use are often based on internet resources or published books that present a highly misleading picture of water fluoridation. In fact, due to this misleading material, there are already several cities who have voted to remove fluoride from their drinking water. These fallacies have also led to people using fluoride-free toothpaste and other dental care products. Now let's talk about fluoride and why we should use it and support public water fluoridation. Fluoride is a naturally occurring element that can be found in water. According to Matthew Messina, community water fluoridation is adjusting the natural level of fluoride to a sufficient level for protection against tooth decay while maintaining public safety. When you drink fluoride in water, it is taken into the enamel of the teeth as they develop and before they erupt, making them stronger and more resistant to cavities. After teeth erupt, topical fluoride continues to strengthen the tooth structure, further preventing tooth decay by reversing the early stages of cavities and promoting the remineralization of enamel. The fact is that when you use fluoride, it turns your teeth into strong little soldiers that are capable of winning the battle against tooth decay. The people who argue against fluoride will tell you that fluoride is a toxin, that it causes cancer, and that it leads to other bodily dysfunction. They claim to have scientific research that backs up their beliefs. However, according to Gina Shaw, scientific studies used to support such links often have methodological flaws, such as studying much higher levels of fluoride exposure than are commonly found in the community, or improperly extrapolating data from animal to human research. Now, I'm not going to try to tell you that fluoride has no risk at all. Just like every other vitamin, mineral, and element found in nature, if you take too much, it can be toxic. The most accepted concern with fluoride is fluorosis, which according to Al-Shahiri and Kujan is a developmental disturbance of the dental enamel that is primarily caused by exposure to high concentration of fluoride, especially during tooth development. The enamel disturbance leads to what we call a mottled appearance, which is basically the teeth develop with brown spots. These spots make the enamel in that tooth weak. In an article in Ascribed Higher Education News Services, it says, young children who consume substantial amounts of fluoride through infant formula and other beverages mixed with fluoridated water or by swallowing fluoride toothpaste have an increased chance of developing mild enamel fluorosis. These, however, are all risks that are known, and precautions are taken to avoid these outcomes. Water fluoridation regulations keep fluoride at a safe level. Doctors instruct mothers to use purified bottled water to make infant formula, and dentists educate parents to teach their children not to swallow their toothpaste or mouth rinse. Everything that I've talked about to this point shows that the benefits of fluoride use far outweigh the risk. And recent advances in fluoride technology offer more protection against tooth decay than ever before. Products like varnishes, gels, and rinses can help decrease the prevalence of cavities around the world. Fluoride varnish is a highly concentrated form of fluoride that is brushed onto the tooth by a dental professional. In research done by Shamarati, Hunter, and Swain, varnishes prolong the bioavailability and the retention of fluoride onto the tooth surface and have exhibited significant clinical efficacy in the reduction of dental cavities. New gels and rinses containing stannous fluoride are also leading the charge against tooth decay. They work in much the same way as fluoride varnishing and can significantly reduce the number of children and adults that have decayed, filling, or missing teeth. We need to continue to work to promote the use of fluoride around the world. We need to advance the water fluoridation into rural areas that cannot afford to do the program instead of rolling back programs that already exist. We need to promote programs that provide fluoride varnishes, gels, and rinse treatments to areas that have little to no access to care. By doing this, we can continue to make tooth decay a thing of the past. In conclusion, although there are people out there who will try to tell you that fluoride is harmful, that you should not use it, and we should take it out of drinking water, they have no research to back up their claims. Fluoride protesters are doing nothing more than fanning the flames of an anti-fluoride witch hunt based on speculation and misguiding information. When appropriately used, water fluoridation, fluoride toothpaste, rinses, and varnishes help keep teeth healthy and strong while causing little to no risk to your health. Now that you know the facts about fluoride and how it can benefit your oral health, you should be sure to brush your teeth twice a day with a fluoride toothpaste, rinse with a fluoride mouth rinse, and get a fluoride varnish treatment applied by your hygienist twice a year. Also, stay informed about public fluoride programs in your area. Contact your local representatives and sign petitions to advance these programs and to keep them in place if necessary. Thank you very much.